Now, nutrients can be of two types. One is macronutrients, which are needed in bigger quantities, and that includes carbohydrate, protein, and fat. And the other is micronutrient, that is required in very small quantities, in microgram or milligram, that is vitamins and minerals. Now, undernutrition and malnutrition, often we say in the same way, but they are not actually the same. But for practical purposes, they are taken synonymously. Malnutrition means, what is malnutrition? Malnutrition means disorder in nutrition. So, disorder can be overnutrition and it can be undernutrition. Overnutrition gives you obesity, undernutrition gives you the real malnutrition we see in our wards or in our clinics. So, undernutrition and malnutrition, they are taken synonymously and they are taken as deficiency of macronutrients or micronutrients. Even one single deficiency of a single micronutrient is also undernutrition. You have to understand. Vitamin D deficiency we very often see in our clinics, that is also undernutrition. And the gross undernutrition cases, which are rarely seen nowadays, they are also definitely, they also fall under the category of undernutrition. So we shall say malnutrition. Now why malnutrition is so important? Because in malnourished children, the death rate, that is the mortality, is very high. According to WHO criteria, according to WHO statistics, 45% of all 5 years death are due to malnutrition, or they fall in the group of malnourished children. And in India, that statistics goes up to 68%. That means death below 5 years, if you compile all the cases, then you will see that 68% of the cases, 68% of the children dying are malnourished. So you know how important this is. Now, malnutrition, what are the effects? They cause, number one, slow growth. They give you low immunity and high chances of infection. And of course, when the child grows up, there is reduced cognitive ability and lower productivity. They cannot be better citizens. Okay. What else? Malnutrition is carried down the, one malnourished girl of today will grow as malnourished and she will give birth to a low birth weight baby. So, malnutrition is carried along generations. That is more important. And one more important thing is that moderate malnutrition is often unrecognized. That means when the early signs and symptoms of malnutrition appear, they evade our views. So that is undetected. And when they go to severe malnutrition, then we know the child is malnourished, and then it is too late. Because early stages of malnutrition are easier to, let us see how to detect malnutrition. We have to detect early. So early detection of malnutrition is very important. Concept of nutritional anthropometry. What is the definition? Use of body measurements to assess. Body measurement means body weight, length or height. Why length or height? Below 2 years, we often say that the length is to be measured, supine length. And after 2 years, above 2 years, we see the height. Okay. So the definition is the use of body measurements to assess human nutritional status, especially in the growing period of life, that is infancy to adolescence. We have to record the age, we have to record the gender, we have to record the body weight, and we have to record the length or height, as the case may be. Now we have to combine the two measurements to make one index, like weight for age. There are definite charts made by WHO and made by our Indian Academy of Pediatrics, which will tell you that whether the child, say a child of 4 years comes to you in your clinic, and we see that the weight of the baby is only 12 kg. From the chart, you will understand that the weight should be around 16 kg. So you know the child is malnourished. This is it, how we measured weight for age. And length or height for age. A child of 4 years comes, say, he or she is, say, 85 centimeters tall. So, 100 centimeters should be the proper weight at 4 years. So, you understand that the weight for, the weight for the length or height for age is less. So, the baby is stunted. This is called stunting. Okay. The weight for length or weight for height, there are definite charts showing you the proper or the normal weight at every height. And if the child falls below that, then we know that the child's weight for height is less. And that is called, what is that called? That is called wasting. Because a normally tall child, if he is less body weight, then he will look what? Wasted. So that is called wasting. So wasting and stunting, they are two aspects of detecting malnutrition. Body mass index is generally used to assess obesity, and mid upper arm circumference, that is also very important. If the child is 6 months to 5 years of age, then measuring mid upper arm circumference will give you idea that the child is malnourished or not. Now, acute malnutrition and chronic malnutrition. When do we say acute malnutrition? When the onset is recent, the weight is affected more than height. Naturally, if the malnutrition is of recent onset, the height does not get proper time to get reduced. So, weight is reduced then. So, this is acute malnutrition. Chronic malnutrition, it should be of longer duration, and weight and height both are affected. And it can be acute and chronic. That is, a stunted child of chronic malnutrition may get acute malnutrition due to some infection or acute lack of food. In acute malnutrition, the child will appear wasted, and there should be disproportionate wasting. Weight for age is small, height for age is normal, because in acute malnutrition, the height, uchchota to ar komte pare na. So height will be normal, but weight will be small, and weight for height will be small. In chronic malnutrition, it is called stunting, that is proportionate. That is, height is reduced because the child does not grow, and the weight is also reduced. So weight for age is small, height for age is also small, and weight for height is normal. The child will look proportionate. That means smaller but not wasted. And acute and chronic malnutrition, weight for age will be small, height for age will be also small, and weight for height will be also small. So this is the category of acute and chronic malnutrition. Now another categorization, moderate or severe. Now classification done on statistical analysis of data, that is made by WHO. WHO chart is there for 0 to 5 years of age, and IAP chart is there for 5 to 18 years of age. Now for that, you have to have little bit of concept about statistics, particularly median, percentile, and standard deviation. Now what are they? Now if you compile the data from a population of any aspect, say the marks scored by you in your examination, and we put the data along in the increasing order along the x-axis, and we put your number who has scored the data along the y-axis. Say suppose say about 60% marks has been secured by one of your students. He falls there. So about 50 students have got the 60% marks. So this comes along the y-axis. And then we get a bell-shaped curve. That is called Gaussian chart. So we see that lesser number of students have secured lesser number of marks. Average number of students have secured the average number of marks, and even lesser number of students have secured the greatest number of marks. So the This is called frequency and this is called the variable. So variable according to the, according to the uh, increasing order is placed along the x-axis and the frequency is placed along the y-axis. So they are arranged in increasing order. Now what is the median? Median is that point where 50% of the value falls below that. Suppose your roll number 1 has secured, say, 75% marks in the exam, and his rank is the centile. Say he has secured, suppose, 75% of marks, and he has stood, say, 10th in the class. So his rank is how much? ধরো এই ডেটাগুলোকে আমরা সাজাচ্ছি এবং আমরা দেখেছি যে সে 75, এই 75 আমরা দেখব এইখানে যে স্টুডেন্ট তোমাদের থাকবে 75% of the students will be either at par with him or below him. So that is the centile. Actually it is the rank, and median, the point at which half of the students will be below that mark. That is the median and that is the centile. And for any data regarding health, 50th centile is taken as the optimum value or the normal value. Okay. Now what is the concept of standard deviation? See, all the curves are not the same. According to the dispersion, they are classified in different ways. Some statistics are widely dispersed about the median value, and some statistics are there, some population are there who are not that widely dispersed. So standard deviation is the degree of dispersion of values away from the median. And for nutrition related statistics, usually we get that 84th centile there is the one standard deviation above the 50th centile, and 97th centile is 2 standard deviation above, and 99.5 centile is 3 standard deviation above. So this makes our task very easy. If we say 1 centile below normal, that means the child is on the 16th centile, or 1 standard deviation below normal, then the child is on the 16th centile. 2 standard deviation below normal, that is 3rd centile, and 3 standard deviation below normal, that is 0.5 centile. So that makes us more convenient about this. And this is the moderate and severe malnutrition. Moderate malnutrition means the child will fall below 3rd centile, and severe malnutrition means the child will fall below 2nd centile. So if we think about the acute malnutrition, এটা আরেকটু উঠবে উপরে কি গো? হ্যাঁ, এবার ঠিক আছে. If we think about acute malnutrition means of recent onset. So weight for height we will see. Then below 3rd standard deviation, you will get the moderate acute malnutrition, and if it is below below 2nd standard deviation, you will get the acute moderate malnutrition, and below 3rd standard deviation, you will get the severe acute malnutrition. And for chronic also, and that is the wasting and severe wasting. For chronic also, similarly, you get stunting and severe stunting. If there is edema, it always falls in the severe category. Remember, presence of edema makes the child more vulnerable to infections, which is popularly known as kwashiorkor, and that falls under the severe category. However, the child might weigh, because in presence of edema, the features of malnutrition are often masked. So if there is edema, you will have to say this is a severely malnourished child. Okay. Now, severe acute malnutrition. Why are you so serious about the severe acute malnutrition? Because severe acute malnutrition children are more prone to infections and the death rate is much higher. So, what are the criteria for diagnosis? If the child is 6 months to 5 years, any of the three criteria, that is weight for length or weight for height, less than third standard deviation, or mid upper arm circumference less than 11.5 centimeter, and presence of bilateral pitting edema. Any of the criteria, if present, that gives you severe acute malnutrition of that age. Now, if the child is less than 6 months old, then two criteria come, excepting mid upper arm circumference. Mid upper arm circumference, there is no standard value for less than 6 months old children. One thing is to be noted, that if the child's length is less than 45 centimeter, at birth what should be the length of the child? Normal length, average, any idea? 50 centimeter. So if the child is, say, preterm or IUGR baby, and the length you get is less than 45 centimeter, if there is severe wasting, the only criteria below 45 centimeter length of the child is severe wasting, because we don't have standard charts for all these things. Now, etiopathogenesis. Low birth weight etiopathogenesis means why it happens. Okay. Now, low birth weight babies are more prone to malnutrition. That is number one. Unhealthy feeding habits. Say the child was not exclusively breastfed, the breastfeeding was discontinued, or the mother goes out for some job and the child is given formula milk, or he is given diluted cow's milk. There is, at 6 months of age, the child should be weaned. The child should be given supplemental food, and they have got no, they do not know about it, and they are continuing with the milk feed till the child is 1 year of age, and the child is not getting enough calorie, the child is not getting enough protein, so the child is malnourished. Infections and infestations. If the child is not breastfed, he is very prone to infections. Bottle feeding, improper sterilization of bottles, all these make the child vulnerable to infections and infestations. Formula feed is a dangerous thing because they cannot often purchase the formula because of lower socioeconomic status. And what happens? They give just diluted formula milk. And lack of calorie, lack of protein makes the child undernourished. Social factors like, high pressure advertisements in the television about the baby food company, they want their product to be sold, and and just viewing the TV or viewing the reels on mobile, they get the idea that their milk is not good, mother's milk is not good, and they are pressurized to purchase the formula milk. Poverty is a very dangerous thing which makes everything bitter. They cannot buy food, they cannot buy even the proper vegetables, they cannot buy the proper source of protein, fish or egg, they cannot buy, and large family size, very close spacing of the children makes them vulnerable to malnutrition. Now, what are the changes occurring? Whenever there is lack of calories, whenever there is lack of protein, then earliest thing happens is that the fat store is mobilized. You often, if you see any malnutrition patient in your clinic, you will see that the subcutaneous fat is not there. The subcutaneous fat is very reduced. The child looks wasted. So that is the first thing that happens. The fat store is mobilized. Later on, protein is mobilized. So what happens? The muscles are wasted and the subcutaneous fat is not there, or subcutaneous fat is reduced. There is a thing called reductive adaptation. Reductive adaptation. That means whenever there is shortage of calories and proteins, the body tries to adapt. So what happens? The growth and activity gets reduced, the child gets lethargic, especially the kwashiorkor children, they are lethargic and not responding to you, not responding to their parents' call. So this is the first thing, the growth and activity will be reduced. Basal metabolism slows because protein turnover reduces. Basal metabolism, the child will cold. If you feel the extremities, they will feel cold and they are not active because loss of basal metabolism. Functional reserve of organs, all the organs, they are affected, especially the organs which are more active, which are metabolically more active and which are more vital for the, vital for life, they are affected more than other organs. So which are the organs affected? Subcutaneous fat. It has got the least metabolic activity, metabolic rate. And what else? Muscle at rest. Muscle at rest. When a muscle is not active, then the metabolism in the muscle is less. And that is the first one to be affected in a malnutrition. Fat and muscle. Okay. So, the functional reserve of organ decreases, and very importantly, the sodium potassium pump slows down because the sodium potassium pump needs ATP, needs energy. In all cells, every cell in the body, the sodium concentration is less and potassium concentration is high. Whereas in the extracellular fluids, the sodium concentration is more and the potassium concentration is less. How it happens? That is because the sodium potassium ATPase pump that pumps out sodium and pumps in potassium inside the cells. Whenever there is lack of energy, this thing slows down. So in malnourished children, in severely malnourished children, you remember that extracellular sodium is less, but intracellular sodium is high. So if you replace the fluid in a high sodium, the fluids of high sodium content, then the child might have volume overload, sodium overload, volume overload, and ultimately congestive cardiac failure. Inflammation and immunity response also decreases. Let's see. Organ-wise effects. নিচে পর্যন্ত পড়তে পারছো তো তোমরা? Last line অবধি পড়তে পারছো? Okay. First of all, come to the liver. Gluconeogenesis and glycogenolysis. That means the liver's capacity to produce glucose is suppressed. So very important thing in severe acute malnutrition is hypoglycemia. And while treating cases of severe acute malnutrition, we shall see about that when we discuss the treatment. You should avoid fasting as much as possible, and particularly the nocturnal fasting you should avoid. Detoxification process of the liver detoxifies every toxin that is suppressed, and excretion of excess protein that is also suppressed. So when you treat a case of severe acute malnutrition, you should give protein in a very calculated way. The kidneys, sodium and excess fluid excretion capacity is reduced. As we have seen that the functional reserve capacity of the organs is reduced, and this is very specially important for kidneys because any kind of fluid overload will lead to congestive cardiac failure. Now heart is one of the organs which are, affected at last. In the ultimate stage, the heart is affected. And the heart, what happens to the heart? It becomes smaller, it becomes weaker, and cardiac output becomes low. Heart and brain, these have got very high metabolic rate and very high activity, and they are very important for survival. So the body tries to spare them in case of malnutrition. Okay. And excess fluid leads to overload. That is one thing you have to remember while you treat a case of severe acute malnutrition. Now, what about muscles? We shall see in our pictures that the muscle mass is reduced and intracellular nutrients are reduced, and muscle glycogen is also reduced. So the baby becomes very lethargic because the energy of the muscle comes from breakdown of glycogen, and that is less, so the activity will be less also. Now GI tract, the acid secretion is reduced, so the digestive capacity is reduced, as well as acid is important to combat microorganisms, and that is also reduced. So there are frequent bouts of diarrhea. Okay. Enzymes are reduced, intestinal villi are flattened. Intestinal villi makes the absorptive surface of intestine many times of the normal, and that is reduced. Why? Because there is lack of protein and lack of energy, so the cell division is less. Whenever the cell division is less, the villi, they are flattened. Okay. And deconjugation of bile acid is also reduced. Motility is reduced, very important. Motility is reduced, intestinal motility, that leads to increased colonization with the bacteria, microbes, and so what happens? Mucosal damage happens. Now electrolytes, you have to remember that in case of malnutrition, extracellular fluid, the whole body water increases from 60%. If we see a normal child, 60% of the body weight is water. In case of malnourished child, about 70 to 80% of the body weight is water. And more of them falls under the extracellular fluid. That is, extracellular fluid expands more than intracellular fluid. And intracellular sodium increases because of the slowing down of the sodium-potassium ATPase pump. And potassium ion leaks out along with magnesium ion, and that is lost in the urine. So during management, as I have said, sodium restriction is important. You have to, in case of diarrhea, you have to give half strength ORS, half sodium ORS, and potassium and magnesium are to be added to the ORS. That is exactly what is done in cases of diarrhea in a severely malnourished children. As far as blood is concerned, the RBC mass is reduced, and as the RBC mass is reduced, the free iron is liberated. And iron, excess iron is always toxic to the body. And normally, in case of normal child, this is detoxified to ferritin. But what happens in malnutrition? The free iron accumulates. Because the conversion of free iron into the ferritin, that needs glucose and amino acid, and that is lacking, so free iron accumulates. And due to the free iron, two things happen. One is the free radicals are released. So free radicals damage the membranes, and that often leads to edema because the vascular wall gets damaged and the fluid comes out, and there is growth of pathogens. This is the effect of the free iron. Okay. So initially, you do not give iron. If you want to treat a case of malnutrition, you do not give iron for the first 7 days. For first 1 week, you need not give any iron. Only give vitamin and minerals to mop up the free radicals. Iron is given after 7 days. Now, clinical features, we have to see two types of severe acute malnutrition, either with edema or without edema. See, this is child of a severe acute malnutrition without edema. This is called marasmus. So the conjunctiva, you see, conjunctiva is dry. I don't know whether you can see from there or not, but the conjunctiva is dry and pale, and there may be signs of vitamin A deficiency, that is bitter spot. Okay. The eyes will be sunken, cheeks shows no fat. The fat in the cheek, that is the last to go. And the fat in the buttocks, that is the first to go. So lips are dry, abdomen is distended because of the accumulation of gas and infection. The muscle contour shows atrophy. You see the muscles of the thigh, you see the muscles around the ribs, you see the muscles around the upper extremities, that is wasted. So atrophy and wasting of muscles. the bones become prominent. You see the femur, you can see from there, the femur is prominent. There is no edema, definitely. There we see edema, there is no edema. And the look is alert. For a marasmus child, the normal look is alert look. Exactly opposite thing happens in kwashiorkor. When there is edema, the baby becomes more lethargic. Okay. And the appetite is normal. The child will look hungry, the child will look alert, and the child will take food. Okay. So this is a closer look. See, the hair is sparse and hypopigmented. The face is wrinkled. They are often called monkey face, but we should not call that. But it's a wrinkled, wizened face. And the eyes appear sunken and dry. The lips are dry, and the cheeks have lost the pad of fat. This is a typical case of marasmus. This is called baggy pant appearance around the buttocks. The fat is not there, the muscle is not there, the gluteal muscle is wasted, and the subcutaneous fat is not there. So, loose skin folds that will give a baggy pant appearance. Now, the skin in a case of marasmus, that is dry and lusterless skin. Dry and lusterless, because we know the skin is also wasted. Okay. Now, this is a case of severe acute malnutrition with edema. All the pictures are taken from, standard textbooks and internet. If you can, you are free to consult books, and there I think you will get better pictures which are not there in this PowerPoint presentation. Classical triad with SAM with edema. Edema, growth retardation, and psychomotor changes. The child definitely, you see from there also, the child looks lethargic and listless and apathetic. Play activity is reduced, interaction is less, the child resists examination, and appetite is lost. So this is called kwashiorkor. So, severe acute malnutrition with edema, the extracellular fluid increases, as I have told you. The cause is why the extracellular fluid reduces. There is low serum albumin, the serum albumin becomes low, and there is increased capillary permeability due to infection and free radical damage. Precipitating factors like measles and diarrhea are often there. And progress of edema, the edema first appears in the lower limb, then it affects the upper limb and face. Trunk is less affected, and ascites usually is absent. You know what is ascites? Free fluid in the peritoneal cavity. Usually there is no ascites unless tuberculous infection and tuberculous ascites. And kwashiorkor child, if you look for the first time, he may show that it's more of a chubby child. It's mota shota dekhte lagbe bachchatake. Ebong dehydration is often masked because of the subcutaneous edema. So these are the skin changes of kwashiorkor. It's called mosaic change. মেঝেতে মোজাইক করলে যেরকম দেখতে হয় দেখো, its skin looks like that. And there is one thing called crazy pavement dermatosis. There is exfoliation, raw hypopigmented patches, and sometimes reddish skin is there. All the features are shown there. And one important thing, one very classical thing about kwashiorkor, which we see very less often nowadays, that is flaky paint dermatosis. The দেয়ালের পেন্ট যখন খুলে বেরিয়ে আসে, ছেড়ে বেরিয়ে আসে, দেখবে পুরনো দেওয়াল হলে, it looks exactly like that. This is called flaky paint dermatosis. The skin, half thickness skin comes out, and that is very angry looking. And multiple punctate pinkish areas on lower limbs that can happen, that is not shown in the pictures. Okay. This is the perioral skin changes of kwashiorkor in a riboflavin. Vitamin B complex deficiency is often associated, and you will see picture like this. Perioral skin changes. জিঙ্ক ডেফিসিয়েন্সি অ্যাসোসিয়েটেড উইথ দিস থিং। আবার দেখো ওটা নেমে গেছে, পলাশ ওটা নেমে গেছে। This is called acute dermatitis enteropathica. There is diarrhea and associated skin changes like this. Around the orifices, around the anal orifice, you may get similar changes, and around the oral orifice, you may get similar changes. Hair changes of kwashiorkor. The hair is hypopigmented, the hair is easily pluckable, and thin hair. Flag sign: the child has got nutrition, proper nutrition for some time, during which the hair is normally pigmented, the melanin has been synthesized, and after that the melanin synthesis has been reduced. So this is called flag sign. So that is the typical flag sign of kwashiorkor. Some part of the hair is pigmented and some part of the hair is depigmented. Other features always present are wasting. All cases of malnutrition, all cases of severe acute malnutrition, whether with edema or no or without edema, there will be wasting. That means the muscles will be wasted, whether you see it or not. Because of the edema, you might see that you might not see the muscle, but they are wasted. There is delayed development, there is pallor due to iron deficiency and folic acid and vitamin B12 deficiencies may be there, and infections, recurrent bouts of infection will be there, and micronutrient deficiency. All sorts of micronutrient deficiency are associated with severe acute malnutrition. Complications like fever, like hypothermia. Hypothermia, why it happens? Because the energy production is less, the fat insulation is less, so the child is often hypothermic. There can be severe weakness and apathy, persistent vomiting because of the intestinal infections, reduced appetite, severe edema may be there, tachypnea, chest withdrawing and cyanosis because of lung infections, severe anemia, pneumonia often associated, and acute and persistent diarrhea. These are the complications of severe acute malnutrition. Okay. Cardiac disorders like congestive cardiac failure, excessive skin and eye lesions, developmental delay or cerebral palsy. The child might get some sort of infection and cerebral palsy. Systemic infection, HIV infection, tuberculosis. They are very often associated with severe acute malnutrition. If these features are present, those features and these features, if they are present, then we can call it a complicated case of severe acute malnutrition. And there is the indication for hospitalization. You cannot treat a severe acute malnutrition case at home. Hospitalization is a must. So that is one of the theory questions, and that is one of the practical questions also. When do we need to hospitalize a severe acute malnutrition baby? Less than 6 months of age, severe acute malnutrition is even more serious. There are additional criteria for hospitalization like recent history of loss of weight, failure to thrive, ineffective feeding. That means that you have to give the feed for 15 minutes, try feeding, and if the child does not take, then hospitalize. And pitting edema and social complications like disabled caregiver. The mother is not able to feed, the mother is psychologically abnormal, or some sort of bad home environment. These make criteria for hospitalization of less than 6 months of age. Now, what is moderate acute malnutrition? We have seen that the moderate acute malnutrition, the body weight falls below second standard deviation and third standard deviation. That means around how much? Second standard deviation is 97, third centile, and this is 0.5 centile. So if the child falls in between the two, then he is not severely acute malnourished, but moderately acute malnourished. Okay. একটু এটা তুলে দাও না। Now recent studies have shown that factors, multiple factors, they are active in a case of Moderate acute malnutrition. That means the child is not yet severely malnourished, but the thing has started, the machinery has started inside him, that multiple factors leading to basal dysregulated pro-inflammatory state. The pro-inflammatory markers are active in the body. Damage to the intestinal epithelia and resulting disorder of barrier function is supposed to play a role. What is the evidence? If you test the blood, there will be elevated level of inflammatory markers like C-reactive protein, that is elevated, gamma interferon, that is elevated, and also intestinal epithelial proteins you will get in the blood along with bacterial endotoxin. Clinical features of moderate acute malnutrition we have to know, because we have to catch the moderate acute malnutrition in the early stage. What are they? The metabolism is adapted to compensate for deficit, that is, the metabolism is reduced. Energy and protein, they are expended more efficiently because there is lack of supply, so the expenditure has to be cut off. And nitrogen excretion in urine and stool is reduced. In later stages, stage B, the physical activity, so these are not the things we can see, but these are the things we can see, that the physical activity is reduced and the child becomes slow and less energetic. Stage C, it's a still later stage, the growth becomes affected, the initial stage, weight gain becomes affected, and not the height, and in the later stage the height gain is also affected. Last stage, like there is some precipitating factor like diarrhea, like measles, the deficit is exaggerated and the child proceeds to severe acute malnutrition. You remember, head circumference is usually not affected even in severe acute malnutrition. The head circumference remains normal unless there is some other CNS lesion like the cerebral palsy. Cerebral palsy patients are more likely to have severe acute malnutrition. So complications of moderate acute malnutrition, one is susceptibility to infection because the pro-inflammatory markers are active and the child is not getting enough energy, so chances of infection are more. It can always progress to severe acute malnutrition and the risk of death. So what are the key messages? Prevention, that is, you have to provide enough food for the baby. You have to advise for exclusive breastfeeding till the child is 6 months of age. That helps. And moderate acute malnutrition stage, you have to catch, you have to detect early. Regular use of nutritional anthropometry for screening whenever the child is seen in your hospital OPD. You have to record the body weight, you have to record the length, and you have to know the clinical features of malnutrition early, and complications, if they come with complications, you have to detect the complications and treat them accordingly. So these are the key messages, and thank you.